Hello everyone, my name is Gry Larsson. I'm a music therapist and I work in a rehabilitation center for adults in Sweden. In my daily work I meet patients with a lot of different needs. After 16 years in this field, I have come to the conclusion most of the music therapy is about communication.
My name is Helen Lindner and I work at the same rehabilitation center as Gry. I am an occupational therapist by profession. I'm also a clinical researcher and I have been using eye tracking technology in my clinical research. And today we're going to present to you a clinical project that we have been using eye tracking glasses to investigate attention and eye contact during music therapy in a patient with vegetative state. This project is about the use of eye tracking technology to investigate eye contact and attention during music therapy in a patient with vegetative state.
Let me begin by telling you a little bit about music therapy in general. Music therapy is an arts and science-based therapy. It relates to an occupation as well as a discipline. It is a clinical use of music to create contact, communication and motivation to reach individual goals within physical, social, emotional and cognitive areas. For example, rhythm and tempo can motivate physical motion. Social interaction can be practiced directly in the music by taking different roles like leading and following. But perhaps the greatest asset of music is to relay emotions and expressions. The therapy is built on expressive and receptive methods, where the therapist makes use of musical creativity, interaction, and the patient's musical experience in that moment. The expressive work is about playing and singing, while the receptive methods are based on listening. From now on, I will tell you about this presentation's specific case. In March 2020, a middle-aged man was referred to me from the rehabilitation clinic 2 months after a serious car crash. The diagnosis was diffuse axonal brain injury. He had lowered consciousness, opened his eyes only for short moments of time, and reacted to pain. Talking to his partner as well as personnel, I was informed that he was an extrovert, 47-year-old father of 3 children, with a strong interest for driving off-road vehicles. I also received a list of songs, including the song When He Always Had Taken His Partner's Hand, as well as Happy Elvis tunes. We agreed to schedule the therapy to pre-noon, sessions once a week, and on a day when the patient did not take a shower, as this was a very taxing morning routine for him. In the beginning, it was not possible for the patient to come to me, which meant that there was a restriction in which instruments I could transport and use. I decided to bring my guitar and some rhythm instruments. In May 2020, I began assessing the body functions of the patient from a music therapy aspect, as you can see in this slide. At this point, I did not see any movement except in his eyes and contraction in his body when coughing. His facial expression was blank, but my experience was that he occasionally used his eyes as if he was aware of my presence. With this starting position, prospects for establishing contact looked bleak. What possible reactions could be expected, and how could they be developed? To exemplify, we have produced 3 fictitious film cuts, starring a colleague. This demonstrates what it could look like when the patient, with his hand resting on an ocean drum, is stimulated by its vibration and rhythm. Here you can see how the patient, with his limited hand movements on the piano, produces sound mirrored by me in, for example, rhythm, tempo, intensity, or volume. This cut will demonstrate an interaction between the patient's blinking and the guitar played by me. We will now take a look at the goals related to these exercises. Here we see a number of aims. I would like to divide them into two groups, active aims and passive aims. For example, increased blinking frequency or the patient using his voice for a longer period of time belong to the active group, while the experience-based goals, as being in a context, belong to the passive but equally important group. Each exercise almost always relates to more than one goal. Now 1 year has passed and I have made observations in different areas of the music therapy. The alertness of the patient has varied during sessions and I have repeatedly experienced that music has woken him up. I have also noticed that songs he recognizes have a stronger effect and probably also certain instruments as the recorder. When I have used his eye blinks to lead my singing and playing, I have observed an increase in blinking frequency. Thanks to the increased arousal and awareness, it has been possible to create moments of interaction where the patient, for example, has used his voice more frequently. Several times the patient has started to cry when we have listened to the love song he used to listen to with his partner. In another song, the crying has more than once begun at the same second as an emotional word or phrase. Also, when I have tried to verbalize the patient's emotions in order to confirm them, he has started to cry. I have taken his crying as, at least partially, a sign of conscious response. It is now time for you to hear Helen Lindner describe how we have used eye-tracking glasses to observe some of the reactions in an objective way.
In the picture on the right, you can see a pair of eye-tracking glasses. The glasses can be used to track eye movements, for example, where the wearer is looking and how many times the wearer looking at different objects and how long it takes for the person to look at different objects. And the video on the right, you will see the music therapist is using an object to test if the patient can use his eyes to follow the object. As we mentioned earlier, in music therapy, the therapists often use familiar songs to stimulate the patient. In this video, you will hear a familiar song to the patient and also to you as well, and I would like you to pay attention to the eye movements of the patient. We have used the eye tracking glasses to collect the number of gaze points of the patients under different conditions. His gaze points was 59 per minute when no stimuli was given to him. But his gaze points went up to 166 per minute when a visual stimulus was given. When the patient was listening to a familiar song by himself in a room without the therapist, his gaze points was 127 per minute. But when the therapist was sitting in front of him and stimulated him using a familiar song, his gaze points went up to 207 per minute. In this video, you will see the music therapist was playing a familiar song with her guitar to the patient, and I would like you to pay attention to the eye movements of the patient on the guitar. One clinical implication of using eye tracking glasses in music therapy is that the technology objectively quantifies eye movement and attention over time, which enables the therapist to follow up the changes in arousal and attention in patients with severe brain injury in quite a reliable and objective way.